How do we know if there is a raised intracranial pressure in craniosynostosis? Now, raised intracranial pressure can manifest in many ways. Now, clinically, what do we look at when we see a child with raised craniosynostosis? Does your child has recurrent vomiting? Does your child has headaches? Does your child started behaving slightly differently with a lot of anger issues or irritability and things like that? Is your child lagging behind at school? That's also one of the very subtle signs clinically of raised intracranial pressure in craniosynostosis. Is your child having vision problems, blackouts and things like that, which are some of the early signs that the optic nerve is getting compressed by the raised pressure in the brain? These are the 4 or 5 things that you need to look at in your child to know whether there are any signs of craniosynostosis leading to raised intracranial pressure. Now, once we have established that there is some doubt that there is a raised pressure, we do a few tests. One of the most commonly done tests is an eye check. As I told, the optic nerve can get compressed in raised pressure, and one of the early signs that we see in an eye check is something called as a papilledema. Now, papilledema is basically swelling in the optic disc, that is the head of the optic nerve. If there is a swelling in the optic nerve or around the optic nerve, we can be pretty sure that the pressure in the brain is high. That's why it's a very simple test done by an ophthalmologist. They put some drops in the eyes of the child to dilate the pupils and then do an eye checkup to check whether there is a papilledema or not. To go a little bit more, there is something called as a B scan that we do, which also shows whether there is any swelling around the optic nerve and how the optic nerve condition is. Is there any pressure that is falling on the optic nerve from the brain or the CSF fluid? Now, this also can give us an indication that whether there is a raised intracranial pressure or not. Now, if there have been some eye signs also, in addition to the clinical signs, we usually get a CT scan done. In the CT scan, what we can see is a very tight brain. There is no space in the skull at all. The brain is totally attached to the skull, and what happens is this pressure on the skull forms something called as a scalloping appearance or a copper beaten appearance of the skull. Now, this is a very accurate sign of raised intracranial pressure in craniosynostosis. In addition to it, there are some more things that we see in the brain which gives us a doubt whether there is a raised cranial pressure or not. For example, the difference between the white matter and the gray matter of the brain becomes a bit blurry because of the raised pressure. Now, these are some of the technical things that we see in a CT scan. If there is still doubt whether your child has raised cranial pressure or not, ultimately we go in for something that we call as an invasive brain pressure monitoring. Now, how do we do that? Our neurosurgeons make a small burr hole in the skull, and then we insert a probe into the brain and do the measurements of the pressure in the brain overnight, and we usually get a proper report. It's called as invasive cranial pressure monitoring, intracranial pressure monitoring. That is very, very rarely required. We almost never do it because most of the other diagnostic modalities give us a good idea whether there is a raised cranial pressure or not.